Welcome to today's video about side effects of Pregabalin. Picture this. You're prescribed a medication to help with chronic nerve pain or anxiety, and while it brings some relief, you begin experiencing unexpected symptoms that nobody warned you about. This is the reality for many people taking Pregabalin, also known by its brand name Lyrica. While this medication has genuinely helped thousands manage conditions like diabetic neuropathy, fibromyalgia, and generalized anxiety disorder, there exists a comprehensive list of documented side effects that every patient deserves to understand before starting treatment. Today, we're examining 10 scientifically verified side effects of Pregabalin that have been documented through rigorous clinical trials and peer-reviewed medical research. This isn't fear-mongering or speculation. Every single piece of information you'll hear comes directly from established medical journals, FDA warnings, and controlled clinical studies conducted by reputable research institutions. Understanding these side effects matters because knowledge empowers you to have meaningful conversations with your healthcare provider and make informed decisions about your treatment. Many patients start Pregabalin without fully understanding what they might experience, and that lack of information can lead to unnecessary suffering or unexpected complications. Before we proceed, this is crucial. Everything discussed today is for educational purposes only and should never replace professional medical advice. If you're currently taking Pregabalin or considering it, your healthcare provider remains your most important resource. Now, let's dive into what clinical research actually reveals about Pregabalin's side effects, starting with one that affects nearly 1 in 3 patients. All right, let's dive straight into the list of Pregabalin side effects, starting with number 1, dizziness. The first side effect we must address is dizziness, and the research statistics are genuinely striking. Clinical studies published in peer-reviewed medical journals document that approximately 24 to 30% of adult patients in controlled trials experienced dizziness while taking Pregabalin. That's nearly 1 in 3 people. To put this in perspective, studies comparing Pregabalin to placebo found dizziness occurred in 31% of Pregabalin patients versus only 9% of those receiving placebo. This isn't mild, occasional lightheadedness that passes quickly. Patients describe persistent sensations of unsteadiness, vertigo, or feeling as though their surroundings are spinning. A systematic review and meta-analysis of randomized controlled trials identified dizziness as one of the most significantly associated adverse events with Pregabalin use. The research shows this side effect tends to be dose-dependent, meaning higher doses increase the likelihood and severity of dizziness. The mechanism behind this dizziness relates to how Pregabalin affects the central nervous system. By binding to calcium channels in nerve cells and reducing neurotransmitter release, Pregabalin doesn't just target pain pathways, it also impacts balance and spatial orientation systems throughout the brain and inner ear structures responsible for equilibrium. What makes this particularly concerning is how dizziness affects daily safety and quality of life. Driving becomes dangerous when you can't reliably judge distances or feel constantly unsteady. Climbing stairs, using ladders, or operating machinery poses serious injury risks. Even simple activities like grocery shopping or walking on uneven surfaces become challenging when vertigo strikes unexpectedly. For older adults already at increased fall risk, Pregabalin-induced dizziness creates additional hazards that can result in fractures or head injuries. Next, side effect 2, somnolence. Our second major concern involves somnolence or excessive drowsiness, which research shows affects a significant portion of Pregabalin users. Clinical trials document that approximately 22 to 23% of patients treated with Pregabalin experienced somnolence compared to only 7 to 8% of placebo-treated patients. One long-term anxiety disorder study specifically found that 7.6% of patients experienced clinically notable somnolence requiring medical attention. Somnolence with pregabalin isn't simply feeling tired enough to want an afternoon nap. Patients describe overwhelming, irresistible drowsiness that strikes during important activities. People report struggling to stay awake during work meetings, while driving, or during family conversations. This profound sleepiness occurs because pregabalin depresses central nervous system activity, creating generalized slowing of neural signals throughout the brain. Research indicates that somnolence risk increases when pregabalin is combined with other central nervous system depressants, including alcohol, opioids, benzodiazepines, or certain antihistamines. Studies show elderly patients may be particularly vulnerable to this side effect due to age-related changes in drug metabolism and baseline neurological function. What makes somnolence especially problematic is its unpredictability. Some patients experience severe drowsiness, even at lower doses, while others tolerate higher doses without significant sleepiness. The timing varies too, with some people most affected in mornings, while others experience waves of exhaustion throughout the day. This inconsistency makes planning daily activities nearly impossible. The impact extends beyond inconvenience. Excessive daytime sleepiness reduces work productivity, strains personal relationships, and creates safety hazards in any situation requiring alertness. For people whose jobs involve driving, operating equipment, or making critical decisions, pregabalin-induced somnolence can be career-threatening. Students find concentrating in class difficult, and parents struggle to stay alert while supervising children. Next, side effect 3. Weight gain. Weight gain emerges as one of the most distressing side effects documented in multiple clinical trials. Research published in reputable medical journals consistently identifies significant weight gain as a notable adverse effect. Clinical studies examining pregabalin use for up to 14 weeks found that 9% of patients gained 7% or more of their baseline weight, compared to only 2% of placebo-treated patients experiencing similar gains. The mechanism behind this weight gain is multifaceted. Research suggests pregabalin affects metabolic processes and appetite regulation in ways that promote fat storage and increase food intake. Patients frequently report experiencing increased hunger and strong cravings, particularly for carbohydrates and sweet foods. However, metabolic studies indicate that even patients maintaining their usual eating habits often gain weight, suggesting metabolic changes beyond simple caloric excess. A comprehensive analysis of patient-level data from multiple studies found that the majority of patients, approximately 82%, remained within 7% of baseline weight. However, approximately 15% became delayed weight gainers, exceeding 7% weight gain during extended treatment. The weight gain appears related to both dose and duration of exposure, meaning higher doses taken for longer periods increase risk. This weight gain carries serious health implications beyond cosmetic concerns. Substantial weight gain increases risk for type 2 diabetes, cardiovascular disease, joint problems, and can worsen existing medical conditions. For patients taking pregabalin for fibromyalgia or chronic pain, additional weight puts extra stress on already painful joints and muscles. The psychological impact shouldn't be underestimated. Many patients taking pregabalin for chronic pain or anxiety find that unwanted weight gain exacerbates their mental health struggles. They face a difficult choice between managing their original condition and dealing with significant weight gain's physical and emotional consequences. Next, side effect 4. Peripheral edema. Peripheral edema, The medical term for swelling in extremities, including ankles, feet, and hands, occurs in a notable subset of pregabalin patients, according to published clinical research. Studies document that peripheral edema occurred in approximately 6 to 9% of pregabalin-treated patients compared to 2 to 3% of placebo-treated patients in controlled trials. Research shows this side effect is dose-related, with incidence ranging from approximately 4% at lower doses to 12% at higher doses. The swelling mechanism involves how pregabalin affects blood vessel function. Research suggests the medication may act as a calcium channel antagonist in blood vessels, causing vasodilation that allows fluid to leak from bloodstream into surrounding tissues. Patients describe waking with swollen ankles, finding shoes no longer fit by day's end, or noticing rings becoming uncomfortably tight. In severe cases, the swelling becomes painful and limits mobility. Clinical studies note that peripheral edema with pregabalin isn't associated with deterioration in renal or hepatic function, suggesting the mechanism differs from edema caused by organ dysfunction. However, research has identified concerning interactions, particularly with thiazolidinedione diabetes medications. Studies found peripheral edema occurred in 19% of patients taking both pregabalin and thiazolidinediones, compared to 8% taking pregabalin alone. What makes peripheral edema problematic beyond discomfort is its potential to signal cardiovascular stress. For patients with pre-existing heart conditions, additional fluid retention can worsen cardiac function. Post-marketing reports have documented cases of congestive heart failure in some patients receiving pregabalin, though establishing direct causation remains challenging. Beyond physical concerns, peripheral edema affects daily life practically. Walking becomes difficult when feet and ankles are swollen. Clothing and footwear choices become limited. The visible swelling causes self-consciousness. For people whose work requires prolonged standing or walking, this side effect can make their jobs significantly more challenging. Next, side effect 5. Dry mouth. Dry mouth, medically termed xerostomia, represents our 5th significant side effect, with substantial documentation in clinical trial data. Research published in systematic reviews documents that dry mouth occurs in approximately 4% of patients receiving pregabalin, compared to less than 1% of placebo-treated patients. Studies indicate this side effect appears dose-dependent, becoming more common at higher pregabalin doses. The dry mouth experienced by pregabalin users isn't occasional thirst, easily remedied by drinking water. It's persistent, reduced saliva production that creates constant mouth dryness, difficulty swallowing, problems speaking clearly, and altered taste perception. The underlying mechanism remains not fully understood, though research suggests pregabalin may affect autonomic nervous system regulation of salivary gland function. Saliva plays crucial roles beyond keeping mouths moist. It contains enzymes beginning digestion, antibodies fighting oral bacteria, and minerals protecting tooth enamel. When pregabalin reduces saliva production, these protective mechanisms are compromised. Clinical evidence shows chronic dry mouth significantly increases risk for dental cavities, gum disease, oral infections, and persistent bad breath. Patients taking pregabalin long-term often develop expensive and painful dental problems stemming directly from reduced saliva. The impact extends to eating and nutrition. Many patients report dry mouth makes consuming certain foods difficult or unpleasant. Dry, crumbly foods become nearly impossible to swallow comfortably. Altered taste perception can reduce appetite or make previously enjoyed foods unappealing, potentially contributing to nutritional deficiencies. Additionally, constant discomfort and the need to frequently sip water throughout day and night disrupts sleep and normal activities. Patients describe carrying water bottles everywhere, waking multiple times nightly to drink, and feeling embarrassed during conversations when mouth dryness affects speech clarity. These seemingly minor inconveniences accumulate into substantial quality of life impacts. Next, side effect 6, visual disturbances. Visual disturbances including blurred vision, double vision, and other ocular problems constitute our sixth significant concern. A comprehensive systematic review and meta-analysis of randomized controlled trials identified visual adverse events as significantly associated with pregabalin use. The research documented that diplopia, blurred vision, and amblyopia appeared in dose-dependent patterns, with blurred vision and amblyopia emerging at 300 milligrams daily, while diplopia occurred primarily at 600 milligrams daily. Visual disturbances manifest in several ways. Blurred vision is most commonly reported, where patients describe eyesight becoming fuzzy or out of focus, similar to looking through dirty glass. Double vision, where single objects appear as two separate images, has been documented in clinical trials. Some patients report problems with visual tracking, difficulty focusing on moving objects, or experiencing visual field changes where peripheral vision seems diminished. These visual changes occur because pregabalin affects neural transmission throughout the nervous system, including pathways involved in vision. The medication's impact on calcium channels can interfere with normal signal processing in the visual cortex and nerves controlling eye movements. Research indicates these visual disturbances can fluctuate throughout the day, sometimes correlating with peak medication levels in the bloodstream. The practical implications are serious and far-reaching. Reading becomes difficult and potentially headache-inducing. Driving safely becomes questionable or impossible, with some patients forced to surrender licenses temporarily. Activities requiring visual precision, whether for work or hobbies, become challenging or must be abandoned entirely. Concerning case reports have documented more severe visual complications. Published research describes cases of bilateral serous macular detachment and central serous chorioretinopathy occurring in patients taking pregabalin, though these remain rare. For patients already experiencing age-related vision changes, pregabalin's additional visual effects can be particularly problematic. Next, side effect 7, headache. Headache emerges as our seventh significant side effect, though interestingly, research presents somewhat complex findings regarding this symptom. While headache occurs among common adverse events in clinical trials, some studies examining pregabalin for migraine prevention have shown the medication can reduce headache frequency in certain populations. However, for many patients taking pregabalin for other conditions, new or worsened headaches become problematic. The headaches associated with pregabalin use vary considerably in presentation. Some patients describe tension-type headaches characterized by constant pressure or tightness around the head, as if wearing a too tight band. Others experience more severe throbbing headaches resembling migraines, complete with sensitivity to light and sound. Clinical trial data indicates these headaches can occur sporadically or develop into chronic daily patterns persisting throughout treatment. What makes these headaches particularly frustrating is their resistance to typical pain relief strategies. Many patients find that over-the-counter pain medications provide only partial or temporary relief. The headaches may intensify during the day or worsen with physical activity. Some individuals report headaches are worse during initial treatment weeks or following dose increases, while others develop headaches only after extended medication use. The neurological mechanisms behind pregabalin-induced headaches likely involve multiple pathways. Changes in neurotransmitter levels, alterations in blood vessel tone, and shifts in pain processing systems throughout the brain all potentially contribute. Research has also suggested that the medication's effects on sleep quality, and the presence of other side effects like dizziness may create conditions triggering or worsening headaches. For patients already dealing with chronic pain conditions, adding medication-induced headaches creates a complex cycle of pain, becoming increasingly difficult to manage effectively. The irony of experiencing new pain while taking medication meant to relieve pain isn't lost on these patients. Side effect 8. Insomnia and sleep changes. Insomnia and various sleep disturbances constitute our 8th side effect, presenting a paradoxical situation. While some patients experience excessive somnolence, others struggle with opposite problems of being unable to sleep when needed. Clinical research has documented sleep-related adverse events associated with Pregabalin treatment. Though interestingly, other studies show Pregabalin can improve sleep in patients with anxiety disorders or chronic pain. The sleep disturbances extend beyond simple difficulty falling asleep. Patients report trouble initiating sleep, frequent nighttime awakenings, early morning awakening with inability to return to sleep, and generally feeling unrefreshed despite spending adequate time in bed. Some individuals describe their sleep as lighter and less restorative, waking frequently throughout the night without clear cause. Research examining Pregabalin's effects on sleep architecture suggests the medication can alter normal progression through sleep stages. Studies show Pregabalin increases slow-wave sleep while potentially affecting other sleep phases. This disruption means that even when patients achieve what seems like adequate sleep duration, the quality may be compromised, leaving them feeling fatigued and unrefreshed. The consequences of poor sleep extend far beyond nighttime discomfort. Chronic sleep disturbances compound other side effects like daytime drowsiness, creating a vicious cycle of sleep dysregulation. Cognitive function suffers, affecting memory, concentration, and decision-making abilities. Mood deteriorates, potentially worsening anxiety or depression. Physical health is impacted as the body loses crucial recovery and repair time that normally occurs during quality sleep. For patients taking Pregabalin to manage chronic pain or anxiety, the additional burden of sleep problems can significantly undermine treatment goals and overall well-being. The relationship between pain, sleep, and mood creates interconnected challenges where disruption in one area affects all others, making comprehensive symptom management increasingly difficult. Side effect 9. Mood changes and suicidal ideation. Our 9th side effect brings us to perhaps the most serious concern: mood changes, depression, and suicidal ideation. The United States Food and Drug Administration issued warnings in 2008 regarding increased risk of suicidal thoughts and behaviors with anti-epileptic drugs, including Pregabalin. Research documents that while the risk is considered relatively low, occurring in approximately less than 1% of patients, the severity of potential consequences demands serious attention. The mood alterations can manifest various ways. Some patients experience gradual onset of depressive symptoms, including persistent sadness, loss of interest in previously enjoyed activities, feelings of worthlessness, and decreased motivation. Others report more acute mood swings, irritability, or sudden emotional outbursts feeling uncharacteristic. Most concerning are documented cases of new or worsening suicidal thoughts, ranging from passive death wishes to active suicidal planning and attempts. Research published in medical journals includes case reports of patients who developed severe depression and even attempted suicide after starting Pregabalin. One study documented 5 cases from approximately 50 patients who experienced suicidal thoughts or increased depression soon after commencing Pregabalin treatment. These patients had histories of depression, but their mood had been stable before starting the medication. Understanding why Pregabalin might trigger these psychological changes involves recognizing how extensively the medication affects brain chemistry. By altering neurotransmitter release and neural excitability throughout the brain, pregabalin impacts regions involved in mood regulation and emotional processing. For individuals with pre-existing mental health vulnerabilities, the risk may be amplified. What makes this side effect particularly dangerous is that patients themselves may not recognize changes as medication-related. Depression can develop gradually, feeling like natural responses to ongoing pain or life circumstances, rather than drug side effects. Anyone experiencing mood changes, depression, or any suicidal thoughts while taking pregabalin should seek immediate medical attention. Next, side effect 10. Respiratory depression. Our final and potentially most dangerous side effect is respiratory depression, particularly when pregabalin is combined with other central nervous system depressants or used by vulnerable patients. In December 2019, the FDA issued serious warnings about breathing difficulties that can lead to death in patients using pregabalin, with opioid pain medicines or other drugs that depress the central nervous system, or in those with underlying respiratory impairment. Respiratory depression means breathing becomes slower, shallower, or less effective at maintaining adequate oxygen levels in blood. In severe cases, breathing can stop altogether, leading to death. This occurs because pregabalin, especially when combined with opioids, benzodiazepines, alcohol, or other sedating medications, can suppress the brain's respiratory drive. The brain centers responsible for maintaining automatic breathing rhythms become overly depressed, failing to signal the lungs to breathe adequately. Research reviewing FDA adverse event reports from 2012 to 2017 identified 49 cases of respiratory depression related to gabapentinoids, with 12 deaths. Of these cases, 34 involved pregabalin specifically. Research showed 92% reported either a respiratory risk factor or use of CNS depressants. Animal studies and clinical trials have demonstrated that pregabalin alone can cause dose-dependent respiratory depression, with effects becoming additive when combined with opioids. The risk increases significantly in elderly patients. Individuals with pre-existing respiratory conditions like chronic obstructive pulmonary disease or sleep apnea, and those with kidney problems affecting drug clearance. The danger is compounded because respiratory depression often occurs during sleep when the person cannot recognize or respond to warning signs. Symptoms of developing respiratory depression include unusual drowsiness, confusion, difficulty staying awake, bluish lips or fingertips indicating low oxygen, and slow or irregular breathing patterns. This risk underscores why pregabalin should only be used under close medical supervision. We've journeyed through 10 scientifically documented side effects of pregabalin, from the commonly experienced dizziness and drowsiness affecting significant percentages of users, through weight gain and swelling, to the potentially life-threatening risks of mood changes and respiratory depression. Each of these side effects is backed by peer-reviewed research, clinical trials, and FDA safety communications, not speculation or unverified claims. The purpose of this comprehensive examination isn't to discourage anyone from taking pregabalin if their doctor has prescribed it for legitimate medical reasons. Pregabalin has genuinely helped many people manage debilitating chronic pain, fibromyalgia, neuropathic conditions, and anxiety disorders. For some patients, the benefits clearly outweigh the risks, and the medication significantly improves quality of life. However, informed consent means understanding what you're potentially agreeing to experience. If you're currently taking pregabalin and experiencing any of these side effects, don't suffer in silence or assume nothing can be done. Speak with your healthcare provider about adjusting your dose, trying alternative medications, or implementing strategies to manage side effects. Never stop pregabalin suddenly without medical guidance, as this can cause dangerous withdrawal symptoms. If this video provided valuable information that helped you understand Pregabalin's side effects better, kindly type "helpful" in the comments. That simple word motivates us to continue producing well-researched, medically accurate content. Please hit the like button, share this video with anyone who might benefit from this information, and subscribe to our channel for more evidence-based health content. Thank you for investing your time in learning about your health today.